The adrenal glands are discussed in this screencast. You may find information on the adrenal glands in Chapter 9 of your textbook. This screencast was designed to help you achieve the following objectives. Identify the location of the adrenal glands. List the hormones released by the adrenal medulla, and for each hormone describe the following. Stimulus of secretion, chemistry, whether it's hydrophilic or hydrophobic, the target tissues and effects of the hormone, and how the hormones are regulated. For the adrenal cortex, list the hormones released and describe for each hormone the following. Stimulus of secretion, chemistry, whether it's hydrophilic or hydrophobic, target tissues and effects, and how the hormones are regulated. The adrenal gland is located on top of the kidneys. In fact, you could say that the kidneys wear the adrenal glands like a hat. The adrenal gland is actually two organs in one. The outer portion is called the adrenal cortex. The adrenal cortex is composed of glandular or endocrine tissue and produces three types of hormones. The adrenal cortex consists of three distinct tissue layers. The outer layer produces the mineralocorticoids, where the major hormone is aldosterone. The middle layer produces glucocorticoids, where the major hormone is cortisol, and the innermost tissue layer of the adrenal cortex produces androgens, which are male sex hormones. The second portion of the adrenal gland is the adrenal medulla. The adrenal medulla is composed of nervous tissue, and the adrenal medulla releases epinephrine and norepinephrine, or what is commonly referred to as adrenaline and noradrenaline, in response to stimulation by the sympathetic nervous system. Let's first discuss the adrenal medulla and the two hormones it releases, epinephrine and norepinephrine. The adrenal medulla contains modified postganglionic neurons. Sympathetic nerve fibers extend from the spinal cord directly to the adrenal medulla, and they stimulate the release of epinephrine and norepinephrine from the cells of the adrenal medulla. Norepinephrine and epinephrine last 10 times as long as norepinephrine as a neurotransmitter, and so the release of these hormones enhances and prolongs the effects of the sympathetic nervous system. So what are the target tissues and effects of epinephrine and norepinephrine? These hormones target cardiac muscle cells, causing an increase in heart rate and also an increase in contractility of cardiac muscle cells. This increases cardiac output, which increases blood pressure and blood flow. These hormones also target smooth muscles of bronchioles, causing those smooth muscles to relax and dilating the bronchioles, increasing the size of the air passages of the bronchioles and increasing the movement of air to and from the lungs, essentially pulmonary ventilation. Epinephrine and norepinephrine also target the cells of the liver, causing a breakdown in glycogen to release glucose to increase and maintain blood sugar levels. So in total, the release of epinephrine and norepinephrine by the adrenal medulla is enhancing the effects of the sympathetic nervous system, preparing the body for an increased level of activity. This helps the body deal with short-term stressors such as physical exercise or an acute injury. The body has increased access to oxygen, there's increased blood flow, there's increased blood sugar available for the production of ATP. The release of epinephrine and norepinephrine is not regulated by any type of feedback mechanism when sympathetic nervous stimulation of the adrenal medulla ceases, there is no more release of epinephrine and norepinephrine. I should also mention that epinephrine and norepinephrine are amines or modified amino acids. Therefore, they are hydrophilic. Specifically, they are referred to as catecholamines, but perhaps that term has fallen out of favor because very few A&P texts use that word to describe these hormones. So here's a question for you. Is the adrenal medulla required for life? That is, if your adrenal medulla was destroyed, or if it were amputated, removed, would you continue to live? And would you have a normal life? The answer to the question, is the adrenal medulla required for life? The answer is no, and you could live quite well without an adrenal medulla. The sympathetic nervous system functions quite well without it. Now that we have discussed the adrenal medulla and the hormones that it produces, let's now turn our attention to the outer portion of the adrenal gland, the adrenal cortex. Let's focus first on the outer layer of the adrenal cortex, which produces the mineralocorticoids. The term mineralocorticoids, what does that remind you of? Well, the very first half of the word is mineral. And indeed, the mineralocorticoids regulate electrolyte levels in the blood. The most important mineralocorticoid is aldosterone. Aldosterone targets the kidneys, and it increases the retention of sodium in the blood. In other words, it causes the kidneys to retain sodium in the blood, decreasing the amount that is allowed to enter the urine. Now, where sodium goes, water follows. So as sodium is retained in the blood, water is retained in the blood as well. Therefore, aldosterone has an anti-diuretic effect. It decreases the amount of water that moves from the blood into the urine. Aldosterone also increases the excretion of potassium in the urine. So while aldosterone increases sodium retention in the blood, it actually increases the movement of potassium ions from the blood into the urine. So, what do you think causes aldosterone to be secreted? Well, it's not very difficult to figure that out if we think about what aldosterone does. So we said that aldosterone increases retention of sodium in the blood by the kidneys. Therefore, it would make sense that a decrease in blood levels of sodium would cause aldosterone to be secreted. We also said that as sodium is retained in the blood, it causes water to be retained in the blood. So it also makes sense that a decrease in blood volume and a decrease in blood pressure would likewise cause an increase in aldosterone release. Lastly, we also said that aldosterone increased the movement of potassium ions from the blood into urine. So it also makes sense that an increase in blood levels of potassium would cause or stimulate the release of aldosterone by the adrenal cortex. The release of aldosterone is regulated by negative feedback. As blood levels of sodium rise, as blood volume and blood pressure rise, as blood levels of potassium fall, there is a decrease in the release of aldosterone from the adrenal cortex. Aldosterone is a steroid. In fact, all of the hormones produced by the adrenal cortex are what are called corticosteroids. They are all steroids produced by the adrenal cortex. Now let's turn our attention to the middle layer of tissue of the adrenal cortex, which produces hormones called glucocorticoids. Cortisol is the main glucocorticoid. And what effect does it have on the body? Well, it encourages the breakdown of tissues and discourages the deposition of tissues. Now, why would one want cortisol to do this? Well, remember that your tissues are composed primarily of fat and protein. And what cortisol is going to do is cause your body to utilize fat and protein preferentially in order to maintain blood sugar levels. So fat is broken down in fat cells in response to cortisol releasing fatty acids and glycerol for the production of energy, ATP, and to synthesize glucose. Protein, mainly in muscle cells, is broken down to release amino acids, again, in order to synthesize glucose, to maintain blood glucose levels. This ensures that in times of fasting or prolonged illness, that there are sufficient nutrients available for basic life-sustaining processes. Glucocorticoids are the hormones of long-term stress. To contrast long-term stress with the short-term stress where we have the fight or flight response, with long-term stress, you're dealing with a stressor over a period of hours, days, weeks, even months. Let's say you're lost in the woods. It's a very traumatic experience. Perhaps you don't have anything to eat. Your glucose stores in your liver are going to be depleted relatively quickly. Glucocorticoids cause your body to break down proteins and fats in order to maintain blood sugar levels. If you're recovering from a major injury, glucocorticoids mobilize fat and protein stores from other parts of the body in order to synthesize the new tissue to replace the tissue that was destroyed. Traumatic events, the loss of a close friend or a similar event that affects you profoundly, where it has an effect on your sleeping habits, your eating habits. These types of stresses cause the release of glucocorticoids to help the body adapt and respond to the stressors. You may find it surprising to learn that glucocorticoids also suppress the immune system. Cortisol specifically inhibits white blood cells that are involved in the inflammatory response, and this may seem counterproductive for a hormone that is secreted in response to damage to the body. However, an excessive immune system response can also be quite damaging. So cortisol secretion and its effect is meant to prevent excessive immune system activity. Long-term secretion of cortisol and other glucocorticoids, however, can significantly delay wound healing, and it can also increase the risk of infection and some forms of cancer. You may have heard an elder say to you over the course of your life that stress can make you sick or that can weaken your immune system. And there is a physiological basis for that statement. Because of the anti-inflammatory properties of glucocorticoids, they are used to treat pain and inflammation. Cortisone is used quite frequently in pain management. You may know someone, or you yourself may have had a injection of cortisone in order to treat inflammation and to help manage a painful condition you may have. Hydrocortisone is used topically on the skin to treat irritations and associated with allergies. And large administrations of glucocorticoids are used to suppress the immune system of organ transplant recipients in order to prevent rejection of the transplanted organs. So what causes the release of cortisol? Stressors cause the hypothalamus to release hormones that target the anterior pituitary gland and cause it to release ACTH, or adrenal corticotropin. Adrenocorticotropin targets the adrenal cortex. It is a tropic hormone and causes the adrenal cortex to release cortisol. Cortisol release is regulated by a negative feedback mechanism. As blood levels of cortisol increase, it inhibits further release of hormones from the hypothalamus. This causes a reduction in the release of ACTH from the anterior pituitary gland, and thus there is a reduction in the release of cortisol from the adrenal cortex. The innermost layer of the adrenal cortex releases a group of hormones called androgens. Androgens are male sex hormones. Testosterone, for example, is an androgen. However, androgens are produced by the adrenal cortex of both sexes. Prior to puberty, androgens contribute to growth spurts as well as the development of underarm hair. After puberty in males, such a large amount of androgens are released by the testes that the amount released by the adrenal cortex is pretty much insignificant. However, in females, androgens appear to contribute to libido or sex drive, and they are converted to estrogens. In fact, after menopause, androgens from the adrenal cortex are the only real sources of estrogen. Androgen release from the adrenal cortex is stimulated by ACTH secretion, much in the same way that glucocorticoid release is stimulated and controlled by ACTH secretion. Androgens, like the other hormones of the adrenal cortex, are steroid hormones. Now let's review the objectives of this screencast. Identify the location of the adrenal glands. List the hormones released by the adrenal medulla and describe the following for each hormone: stimulus of secretion, chemistry, whether it's hydrophilic or hydrophobic, target tissues and effects, and regulation. For the adrenal cortex, list the hormones that are released and describe for each hormone the stimulus of secretion, chemistry, whether it's hydrophilic or hydrophobic, target tissues and effects, and regulation. In our next screencast, we will discuss insulin, glucagon, and diabetes.